At 5, Arkansas ranks 43rd in the country for child well-being, according to a new study. Governor Asa Hutchinson says when it comes to this, the state has made progress but has to do more. Today, he announced new initiatives to improve care for kids and moms. 5 News reporter Catherine Gilker is here. And Catherine, this also comes just weeks into the state's near ban on abortions.
Governor Hutchinson says the state started working on these new initiatives before that near ban took effect. That said, he says about 3,000 abortions were performed in Arkansas last year. Hutchinson says added investment and support is needed, with more babies being born into situations where a mom might have considered an abortion.
The Arkansas Department of Human Services, or DHS, wants to expand Medicaid services for pregnant women to have coverage for all health care needs, including behavioral health services, while they are pregnant and after they give birth.
That will save children's lives as well as the health of the mom. The health of the mom, the mental well-being of the mom is directly related to the well-being of the child. And so when we address one, we address both.
This expansion needs federal approval but is expected to start in January. The state is also looking to extend home visitation services to high-risk pregnant women within traditional Medicaid. Hannah Chung is the education facilitator at Shared Beginnings, a birth family support and adoption agency. She says these initiatives will be life-changing for the women they help, as many don't get prenatal care because of the cost or transportation.
It's either I go and I get into a lot of debt, I'm not going to be able to afford this, or they choose, okay, I'm just not going to get this care and hope everything works out okay. So this extra funding will allow for them to receive the health care that they really desperately need, and it will also make it so when the child is born, they're less likely to have complications.
DHS is also looking to increase monthly payments to foster parents. Chung, who was also a foster parent, says the monthly payments families receive for help with expenses hasn't increased since 2009, while the cost of everything has increased.
Costs quite a bit to raise a child and raise them well, especially when you want these children to feel like any other child. We don't want to treat them any differently than we would a bio child. And so this support from this initiative will really help foster families be able to care for more children potentially, or to care for the children that they have in their home even better.
Another addition will be that grandparents or family members who foster a family member will get the same monthly payments as traditional foster parents. The governor also announced the creation of the Pregnancy and Parenting Resource Center hotline. Catherine Gilker, 5 News.